Good morning, Ma.
Good morning.
Can you kindly introduce yourself?
My name is Eunice. I am the program officer for Joe Foundation for Diabetes.
Thank you for joining us this morning.
Welcome.
All right, so in recent times, a lot of children have been found battling with diabetes. So what would you say are some of the major causes?
There are two types of diabetes, type 1, type 2. Type 1 is mostly hereditary, while type 2 is assigned to lifestyle. Type 1 is also known as juvenile diabetes, and that affects children more. Children have more type 1 diabetes than type 2.
So let's talk about the statistics, of children who are currently living with diabetes and Joe Foundation's efforts towards curbing or containing these cases, especially in Cross River State.
When you ask this question, I often ask myself, is there really a particular number of children living with diabetes? Because you wake up every day and a parent runs to you, check, and is diabetic, and the news of you telling that parent that the child is diabetic, they just attribute it to witchcraft. So right now, in the care of Joe Foundation, I would say we have about 30 children living with diabetes, not counting the ones we have lost.
All right, so how do you bear the news of death of a child living with diabetes to the family, and have they been able to handle it?
I think I have to breathe for this. It's a terrible news getting to hear from a parent of a child living with diabetes of their passing. As it's a tradition in Joe Foundation that we call to check on people living with diabetes, especially children. And then you wake up one morning to a call of the passing of a child whom you have given all assurance that the drugs will help. And then this child just wakes up one morning and is gone. So the grief of those children is something you can't really bear, but it is what it is. It's life and it's diabetes.
So let's talk about some of the challenges you faced in getting people to at least come to Joe Foundation and check themselves.
I think one of the challenges, especially being a program manager, is getting people to come for the tests, especially free. People in this part of the world don't take anything that is free serious. So we have to go to their homes, we have to go to their business places, we have to go to markets, churches, everywhere. But thank God for the serious movement in Joe Foundation. A lot of people have started showing interest, coming to the office to check themselves every Monday. I think I would say it's a right tick for me.
Now, lastly, one word for people living with diabetes.
What I would say is that, and what I always say is, at Joe Foundation for Diabetes, we listen, we care, and you are not alone. Share with us.